Today I had the 1 week appointment after my follow-up appointment when they took the bandage off, and the doctor said everything was great. My eyes were 20/20 minus one letter, which I was surprised about, to be honest, because everything was it's fuzzy enough that I almost feel like it was just a good guess on some of those letters. I think that some of the fuzziness might be a side effect of the eye drops, and I asked the doctor about that, and he thought that could very well be, but he said your vision does keep changing. We discussed the intermediate vision, which hasn't been so good, and he said after your eyes settle down for a bit, then we could get into a progressive lens or something, and that could help make things better. One of the big concerns was the amount of pressure in my eye, which the doctor did reassure me was normal, and he gave me a couple of eye drops to take, and that made everything better. So my eye was normal pressure this morning, so I'm no longer taking those 2 drops, and I'm no longer taking the one that has the tan cap. The one that I am still taking is the one that the hormone. It's like prednisone, but with an extra couple syllables. Prednisolone, or I'm not sure how to say it. Before I made the video, I should have done my homework on that. I went back to work on Wednesday, and it went much better than I thought. My eyes weren't tired. I kept on going between wearing my glasses, the ones that I got with the plano lens, and then the other lens, so that my right eye wouldn't be getting so tired, and then going between reading glasses. And the reading glasses have been an issue, because what reading glasses worked for yesterday, say for being on the big computer, aren't right for today, and so that's definitely changing. And but everybody says that's normal. I'm not having any pain of any kind. My eyes look so good and so normal that everybody's shocked that I had eye surgery just a few days ago. The only eye drops that I have to take now are just the one that's the hormone, the prednisolone, and I only have to take it 3 times a day now. And so that's going to be great. And then what they do is they wean you off that, and then next week I'll take 2 drops a day, and then the following week 1 drop a day, and then that's all. As I've discussed before, one of my issues is that I have amblyopia, which is a lazy eye. So for whatever reason, this eye, the message doesn't get to my brain very well. So while I can see shapes and things, I can't use it to read, and driving would be a disaster. So I don't use it for those things, of course, but it definitely adds to my depth perception and my peripheral vision on this side. One of the things that I noticed is that my eye's doing really well with this. I didn't know if with this eye being so strong, this eye would be lazier and stuff, but it's not. I was sitting there in the mirror, looking at a fixed point in the mirror and moving my eyes around, and they looked like they were tracking just fine. But then every once in a while, being the lazy eye that it is, I'll notice that it seems to go off some other direction. And, it is what it is. It's the eye that God gave me. Usually the only reason I worry about that is for other people's sake, because I think it weirds people out a little bit. And every once in a while I have incidents where somebody will get really mad at me about something. And I've wondered at times if it's because they think I'm looking at them funny or something, or looking at them weird. I never get this strange anger from people when when it's over the phone or over an email, or which is I think where most people have communication problems. But